Good afternoon and good evening. My name is Kat Berza from the Council for Health and Development, the national organization of community-based health programs in the Philippines. My presentation today, Reclaiming Our Right to Health, Pushing Back Against the Privatization of Health Towards a People-Centered National Public Health System, will focus on the impact of privatization in the Philippines and our recommendations for a better health system. This presentation is made in collaboration with Ibon Foundation. The Universal Declaration of Human Rights and the International Covenant on Economic, Social, and Cultural Rights recognize the right to a standard of living adequate for health and well-being. The Vienna Declaration and Program of Action declared that human rights and fundamental freedoms are the birthright of all human beings. Their protection and promotion is the first responsibility of governments. The World Health Organization recognizes that health is not just about being healthy as an individual. Social determinants of health determine other factors that affect the health of an individual and the population. As also stated in the Alma Ata Declaration of 1978, health is not only achieved through direct health services, but is also achieved through different social and economic interventions. And this is the main reason why the states are wholly responsible for the highest attainment of health of their constituents. The 1987 Philippine Constitution under Article 2, Section 15 states that the state shall protect and promote the health of the people and instill health consciousness among them. Privatization is not simply a response to fiscal difficulties and not only to sell off state-owned enterprises. Its direction is to redefine the role of the government. In the course of this redefinition, privatization of health facilities and services has resulted to the abandonment of the state's responsibility to people's health and allowing private business to take over. In essence, privatization is the abandonment of the state's responsibility to ensure people's health and the operation of public health services and institutions into profit-oriented enterprises. In the Philippines, the history of privatization goes back to 6 presidential terms and shows a strong continuation of previous policies and directions in the current administration of President Marcos Jr. The Philippine health system is being operated by a mix of public and private health facilities through the Department of Health and its attached agencies like the Philippine Health Insurance Corporation. Many of the indications of a stable and reliable health system were not achieved in the country because of the lack of support and prioritization of the health system development. Even in the midst of the COVID-19 pandemic, the Philippine government still failed in strengthening the weak health system. The low spending of national and local governments on health resulted in the high out-of-pocket expenditure of the Filipino people. In 2021, the estimated average spending of every Filipino for healthcare goods and services is at 172 euros. Household out-of-pocket payment still remains as a major source of health expenditure with 41.5% share in 2021. The government and social health insurance, which is also paid in full or in part by the individual, has 50.3% share. The high out-of-pocket share caused by low government spending and high cost of health services led to low health utilization of Filipinos, especially those who live in far-flung areas. The rural health units, which is the next level of health intervention after the barangay or village health stations, is also inaccessible because only half of the total country population has access to these health facilities. In 2021, the national average of RHU to population ratio was 1 per 39,541 Filipinos. But on a regional level, the ratio was more severe. For hospitals, 34% are government-owned, while the remaining 66% are privately owned. It is not surprising, therefore, that amid these conditions of health services, 4 out of 10 deaths were not medically attended, and more than half of the recorded deaths occurred at home. Aside from the lack of available health facilities, the Philippine health system is also facing a major issue of health worker shortage and poor working conditions. The Filipino health worker per population ratio continuously decreased in the past years, from 19.23 per 10,000 in 2016, this decreased to 17 per 10,000 in 2021 in the midst of the pandemic. This was already below the recommended level of 41 health workers per 10,000 populations. Among the factors contributing to this shortage is the rampant contractualization of health workers in both the public and private sectors. These poor working conditions and severe lack of sufficient income has pushed many Filipino health workers to work overseas. In the latest government data, an average of 27,050 Filipino health workers were deployed yearly from the years 2015 to 2018, following decades of Filipino health worker migration. In a nutshell, health privatization is aimed to transfer the service provision and financial burden from the state to the private sector and the individual. It leads to the reduction of social spending on health and gears for commercialization of services and implementation of user fees, fiscal economy, corporatization and income retention of hospitals, public-private partnerships, and overall creating an enabling environment for the private sector. With what is happening in the health situation of the Philippines, potential violations can clearly be pointed on the United Nations obligation of states and responsibilities of others towards the right to health, which requires states to ensure that privatization does not constitute a threat to the availability, accessibility, acceptability, and quality of health care facilities, goods, and services. The chronic crisis in the Philippines and the rest of the developing world gave birth to solid mass movement, clamoring for different health system in a society that breeds justice and equity. We believe that only through our collective struggle shall we be able to keep our public health system public, a system that respects, promotes, and protects our right to health. Achieving this is not an easy task, especially when our ranks are constantly threatened. Amid the risks inside and outside hospitals and communities, we must soldier on for ourselves and for the people. The push for the empowerment of health workers and activists is important in the path to a strong health system. Unionization of healthcare workers should be welcomed and supported in order for their rights and needs to be acknowledged and realized. The government should heed the calls of the health workers for better wages and benefits, and employment opportunities, among others. With the current system of health in the country, an overhaul will be needed in order to achieve a free, comprehensive, and progressive national health system that will ensure the accessibility and availability of health care to all Filipinos, with a special preference to the poor and oppressed. Towards this goal, we recommend the following: junk public-private partnership, corporatization, and all forms of privatization. Allocate at least 10% of the gross domestic product to health. Increase budget for government hospitals, health facilities, and services. Ensure an adequate number of health personnel in the healthcare system with job security and just compensation. Renationalize and strengthen the public healthcare system, and enact free National Public Health System Bill or House Bill 208. Maraming salamat po at mabuhay ang mamamayang lumalaban.